Every time an aesthetic surgeon puts someone's face together, he or she also puts a patient's life back together again. The healing, restorative powers of reconstructive surgery and its ability to knit families together, to rebind careers, to restore self-confidence and self-esteem have been the stock in trade of caregivers at the Max Institute of Aesthetic and Reconstructive Surgery. Ever since we opened our doors in 2008, the team at the helm of affairs has been setting new benchmarks in the areas of medical and service excellence. Dowry since time immemorial has been the bane of existence of countless women in India. In today's day and age, sadly, this inhuman practice still thrives. Our next patient of courage is a woman of substance who, when consigned to the flames of fire, emerged strong and determined, the scars on her body notwithstanding.
मेरा नाम अलका है, मैं मैक्स हॉस्पिटल में काम करती हूँ। मेरी शादी 1994 में हुई थी। 2001 में मेरे साथ ये एक्सीडेंट हुआ जिसमें मेरे को 25% बर्न आया। मैं 1 महीना आईसीयू में रही। उसके बाद मेरे 2 साल मेरा कंटिन्यू इलाज चला, जिसमें मेरे इन-लॉज ने, मेरे हस्बैंड ने कोई हेल्प नहीं की। मैं फिर अपनी मदर के घर आ गई। मेरी मदर ने मेरी काफ़ी हेल्प की, जिनके यहाँ मेरी मदर सर्विस करती थी, रेनू आंटी, उन्होंने काफ़ी हेल्प की। जिसमें मेरे 2 बेटे थे, एक 6 साल का था, एक 6 महीने का था। उस बीच में मैंने काफ़ी सफ़र किया। मेरी 2 सर्जरी हुई हैं। एक स्किन ग्राफ्टिंग चेस्ट की हुई जिससे मेरे जख्म नहीं भर रहे थे उसके लिए, एक मेरा हैंड जॉइंट हो गया था उसके लिए। फिर 2 साल के बाद मैं ठीक होने के बाद मैंने सोचा मुझे कुछ काम करना चाहिए, जो ऐसा काम हो जिससे कि मैं अपने बच्चे भी पाल सकूं और मैं दूसरों की हेल्प भी कर सकूं। उसके बाद मैं मैक्स हॉस्पिटल में आई। यहाँ पे आके मेरे को डॉक्टर सुनील चौधरी मिले, जिन्होंने मेरी नेक खोली, जिसमें मेरे नेक और शोल्डर जॉइंट थे। मेरे को प्रॉब्लम होती थी साइड में देखने में, स्माइल करने में काफ़ी प्रॉब्लम होती थी।
Alka's neck was attached to the chest and literally speaking there was no neck. She could not move her neck because it was bent and stuck to the chest. She could not breathe easily as well. She had these bouts of breathlessness off and on. She also could not smile properly because of the contracture she had in the neck. The angles of the mouth, the lips were actually pulled down. Surgical challenge in Alka's case was to reconstruct the neck in its all 3-dimensional glory so that it can move freely. The shape of the neck in 2 planes has to be restored. And as the neck was barely attached to the chest, the release of the neck was fraught with danger because we had to cut into the scar tissue which could be attached very closely to the major blood vessels in the neck.
We anticipated difficulties in providing anesthesia for this patient during surgery. For providing general anesthesia to these patients, we have to put in a tube into the trachea of the patient, which is then connected to a ventilator, and this tube provides artificial ventilation during anesthesia and surgery. This is the true lifeline of the patient during this intense period of anesthesia and surgery. To visualize the trachea, we have to straighten the neck of the patient, which was impossible in Alka's case. So, we used another specialized technique, like using of a flexible fiber bronchoscope to visualize the trachea directly under vision using a computer screen, and then we intubated this patient for providing anesthesia and surgery.
So we went slowly, separated all the tissues successfully, and at the end of this we had a huge raw area from the upper end of the neck to the chest. Now the challenge was to resurface this with a single sheet, a seamless sheet of skin graft. Electrical dermatome, it's a marvel of engineering. That's exactly what we use to harvest these thin pieces of skin. It's a gadget which has an oscillating saw which can actually slice skin at fraction of a millimeter to actually give us the exact dimension that we want. Alka has had a wonderful result. She needs more surgeries to patch up other scars, but she can smile again.
अब मेरे डॉक्टर सुनील चौधरी ने और उनकी टीम ने, डॉक्टर दिलप्रीत ने मेरी काफ़ी हेल्प की। यहाँ मेरी सर्जरी हुई। उसके बाद अब मैं नवंबर में मेरी सर्जरी हुई है और मैं अपने वर्क पे वापस हूँ। मेरे को काफ़ी अच्छा फील हो रहा है। मैं साइड में देख पाती हूँ, स्माइल कर पाती हूँ, ऊपर नीचे सारा देख पाती हूँ। मुझे अब कोई प्रॉब्लम नहीं, मैं काफ़ी अच्छा से फील कर रही हूँ।
A tormenting experience that would leave many embittered made Alka in fact better. Max Healthcare has empowered Alka to make this meaningful transition from being someone in need of care to the one who provides care and succor to many.